Good afternoon, listeners and viewers. It is January the 22nd, 2025, and this is the cover story. I'm Chevon Campbell.
And my name is Sanjay Lewis. How are you, Chevon?
Doing quite well.
Wonderful. It's cover story time, and we're going to turn our attention to the Ministry of Health and Wellness. And that's because Health and Wellness Minister Dr. Christopher Tufton says the government is bringing unprecedented improvement to healthcare facilities across the island. He was speaking at the launch of the ministry's two-day career expo and employment fair at the Mona campus of the University of the West Indies on Wednesday. The health ministry had published vacancies for more than 600 jobs.
Dr. Tufton says the move to enhance the human resource capacity in the health sector reflects the government's vision. He cited the government's 10-year strategic plan to fill several gaps in public health. That plan includes creating more space for patients, providing equipment, digitizing health records, paying healthcare workers better, and creating more permanent posts for doctors. The minister joins us now to discuss further. Good afternoon, Dr. Tufton.
Hi, how are you?
Doing quite well. So, Dr. Tufton, just to ask you, how was the fair today? I understand it was quite well attended.
Well, I'm still here. We go on until
Oh,
8 p.m. and tomorrow again from 9 to 8, 2 days. And yes, it started extremely well, continued throughout the day and still going on. We have a more adult population coming in now. The students came in earlier. Obviously, they have to go back to their respective places, some of them from out of town, including my alma mater, Manchester, the great Manchester High School. Sorry for that plug. And it has gone well. The feedback is very positive. The job fair attracted, I think it's still going on. When I checked recently, about 1,500 persons so far have been screened, and there were still quite a number of persons waiting to be screened and for an initial interview. And we are now touring the private sector delegation so they can see what's happening and sort of explain what is going on. Earlier, the Minister of the Philippines for Health spoke and the Prime Minister at the opening. And I think we're achieving the objective in terms of the numbers, the expressions of interest, and the need to create that kind of awareness as part of the overall strategic plan to bolster more persons going into the field and also the retention of some of those persons through the offering of the Barwin Scholarship.
Which is where I want to take you, Dr. Tufton, because the opposition says this is a PR stunt, and you're on record
Right.
saying not so. Why did the ministry saw the need to do this job fair?
Well, I'm not. I don't even know if it's necessary to respond to what was said about the kind of motive for the event coming from the opposition, because I think those who have come here to experience this will think and know otherwise. But the reality is that, as you said earlier, this is part of a strategic plan that was developed and is now being executed actively with resources put behind it to achieve the overall upgrading of our health infrastructure. It does represent transformation, and it will take time because of all the under-resourced and deficiencies that existed before. So today was one of several planks, which is to build the human resource capacity to fill the positions that are created through compensation review, where we have added additional posts, to fill the positions that will be available when new hospitals are being built. We're building out several, to build the capacity to deal with the more modern diagnostics that are now being procured, and I could go on and on. So you can't expand and improve service quality unless you have people. And it is no secret that we have a shortage because of migration, a shortage because of training needs, deficiencies, clinical rotation space, faculty shortages. And really, health is a service, and it's a service that requires people to manage. So today's event is not to be considered in isolation. It has to be considered as part of a plan, an overarching plan that is intended to upgrade, modernize, and hopefully make more efficient the public health response to the sick profile of our population. And we're very confident that we're doing the right thing. And based on the numbers that have come out here, in terms of people wanting to know all the different career options. A while ago, I was speaking with the private sector group, the medical field, and was getting the numbers of oncologists that are on the island, how many are present, how many are needed, the length of time it takes to train someone for that particular skill set, where they have to train here, where they have to train abroad. That's a detail that you don't often hear about, but frankly speaking, has to be dealt with in order to prepare for filling the posts that are vacant. The reason why the minister from the Philippines is here is because we're signing an MOU tomorrow, and the Philippines is the largest exporter of healthcare workers to the world. Proportionally, Jamaica probably is one other. Philippines are being a much bigger country, of course. We are now combining our efforts to learn from each other, to train more people, to exchange faculty where necessary, and that augurs well for the future to create more people who will be in the system to offer service and reduce wait time and improve service quality. So the opposition or any other person who may be curious as to why this is happening, they can come, we can explain it. I'll give them the benefit of the doubt that maybe they don't understand. But we are very comfortable that we're living true to a plan, and that plan is reflected here today.
And to be clear, Dr. Tufton, your ministry indicated that there are more than 600 vacancies. About how many of those posts that are vacant are actually new posts that have been created by your ministry?
So, to understand these vacancies, you have to have an appreciation for the compensation review and the principle around compensation review in the first instance. And in the second instance, the shortages that have been existing for a long time due to migration or limited training capacity. Compensation review operates on a principle where we have offered to pay our critical staffers more and hopefully allow them to work less hours to earn a livable wage. By so doing, create more posts to bring more people on board so that they can also be efficiently working for the 40-hour week and enhancing the quality of the service without burnout. Those positions, many of those, and therefore we created nearly 2,000 additional posts. And some were appointments from temporary positions that people had or contract labor. Others were new, and the 600 plus are posts that exist in the establishment that have not been filled. And that's what we're trying to do. When other entities come on board, we're going to need more. When Western Child and Adolescent Hospital comes on board, for example, later this year, the optimum level of staffing for that hospital is almost 1,200 people. There are about 200 or so that will come from Cornwall Regional because we would transfer the services of pediatric and adolescent care to the new facility on the same compound, and those medical practitioners will come across. But we're offering a range of additional services that will require new skill sets. And there is an HR plan that defines all the positions, both administrative and clinical. And we have to now start a process of recruitment to fill those positions so that the building will operationalize. So this is not just a target that we pull out of the air. It's drawn from the HR deficiencies at the regional level, and by extension put together to create the numbers that we have with a forecasting and a projection for the future and how we will get there, importantly, hence the Career Expo and the MOU with the Philippines, the one we have with Cuba, and looking at Nigeria and India. We are very clear in terms of what the strategic vision is, and we're living true to that vision in terms of execution.
And on that topic, Dr. Tufton, these posts, we have the traditional ones that people think of, the doctors, the nurses, but you have your normal paths in terms of recruitment for those individuals. I assume these 600 vacancies is something more that the government is looking for in terms of filling those critical gaps.
Yeah, so let me break it down a little. So oftentimes we use the term nursing and doctors in generic terms, meaning you think that it's just any doctor or any nurse.
Yes.
And clearly that's not the case. take nursing, for example. You have a range of categories of workers that provide nursing services, from the very basic, just patient care, to the very advanced, an oncology nurse that focuses on cancer treatment and cancer care, or a nephrology nurse, or a pediatric, and so on. So there are some areas where we have a level of adequacy that can sustain us in the public system. There are other areas where there are severe shortages, where we are 50% of capacity, 40% of capacity, normally in the specialized areas. So there are about 8 categories of specialized nursing. I'll give you an example. I mean, the pediatric space for ill babies at Victoria Jubilee Hospital, whereby best practices you should have a ratio of 1 to 1, maybe 1 to 2 sick babies. These are the early stage births. Sometimes there's a ratio of 1 to 5, 1 to 6. In extreme cases, more. The management of that population, therefore, becomes difficult for that particular nurse. And it's not that the posts aren't there. It is the shortage of that specialist nurse. And for a number of reasons. Sometimes you train them, but the demand in North America, in the UK, in Canada, is so great that those countries, or should I say those health systems, recruit and offer very generous packages. So there's always a competition for that level of speciality, which then creates the gaps that we have. And it's not unique to this year, last year, or the year before. It has been the case for a while. And it does affect the quality of service. And we have said that open and openly. So what I would like us to do is not just to focus on the employment component of what is happening here over the next 2 days, but very importantly, focus on the developmental component that is captured in the health career fair, which is to try and facilitate a development program that will see greater interest in pursuing careers in the different segments of a particular profession. Support that with the scholarship funds, which we have started and will continue for the next 4 years, and then achieve retention through the bonding arrangement, through the scholarship, through better working conditions by building out better hospitals, and all the other things, compensation review and so on that we're offering. So, I heard the talk about retention. Retention is not just determined by high salaries, as important as that is. Working conditions determine retention. Security of tenure determines retention, which is the post that we have created as opposed to contract work. Opportunities for growth determines retention, and I could go on and on. And what the strategic plan does is to give a very holistic approach to understanding the problems and try to address in a much more complex and sometimes nuanced way a development model that will achieve greater results for the patient and for the Jamaican people. And sometimes we simplify our interpretation of what it is, maybe for one reason or the other, and it unfortunately undermines the complex nature of the challenge and why we're doing what we're doing.
And I appreciate that, Dr. Tufton, and the long-term vision is important, but there's still those gaps to fill short-term, and I suppose that is where your attempts to court the Philippines in this matter is also important, because I looked at today's labor market survey, and something that struck me quite interestingly is while they suggest that there's 500,000 Jamaicans outside of the labor force, realistically, in terms of those actually seeking work, that's about 30,000 people. And when you're talking about something such as healthcare, which is a very specialized field in terms of the talent that you need to recruit, Jamaica has to, in some instances, look elsewhere to fill those gaps while you try to build up that long-term capacity, correct?
Right. So part of that strategic plan is how do we create strategic alliances? The reality is, and not often we want to recognize it, politicians included, because it sounds like we're betraying our local people, but labor is highly mobile. the truth is, in a post-COVID environment, particularly a health worker, the more specialized they are, have multiple options. They can go to the Caribbean, they can go to North America. I mean, they don't need to look too far outside of Jamaica to have offers, especially if they're specialized, as I said earlier.
Yes.
The question, therefore, is how do you tweak your strategy to ensure that that mobility can also benefit you? And the way to do that from a policy perspective is to forge alliances. And those alliances include places, in this case, where the skill sets are present, where the tradition of supporting assignments external to their countries are in place. So the Philippines is a perfect case. Not only will we and can we and hopefully will benefit from where the skill sets are scarce, but those skill sets don't just mean people working in hospitals. It means faculty. Because part of the challenge is that we need more faculty to train because there are requirements for qualification, ratio of faculty to student. It requires technical skill sets, biotech engineers to manage the plant and to ensure we don't have downtime. It may require remote access through technology. We have that with Cuba now. I mean, we bring Cubans here and we send Jamaicans to Cuba to train. So it requires apprenticeship training. One of the things we're discussing with the Philippines is to train some of our nurses, specialized nurses, here for a while. Then they go to the Philippines for a few months to go into a hospital. The CMO just came back. She's very comfortable with that environment. They have over 400 hospitals, I'm told. And do clinical rotation to qualify. And so you end up with a joint training arrangement. So that mobility of labor should be seen for us as an opportunity as it is a threat. We know what the threats are. It's migration. We also have to benefit from that mobility in terms of building our own capacity, even if it means that the capacity is built outside of Jamaica. And that's why we think those relationships are important. And that's the perspective we're taking.
I want some clarity, Dr. Tufton, as to what happens at the career fair in terms of interviews, because one listener indicated that they had a challenge where they visited the expo and all that happened was that their resume was collected and the representative told them that it will be sent off to the relevant sections and then the HR department will browse through it. So is it that resumes will be collected at the expos, or are there any plans to do actual interviews or initial interviews for individuals who express an interest in a particular post that is being advertised?
Okay, so the interviewing process normally takes several stages. And I don't think that, and I hope not, we didn't communicate that we would go through all stages to hire or offer a job on spot. Certainly not when you have thousands of people turning up, which we anticipated. So what the team has done is put in place, in the first instance, a interaction with each person who comes, assessment of their resume, visual assessment, an exchange with that individual, and they try to time it to get the productivity levels so we can do as many as possible. So it can't be a half an hour, 1 hour discussion, but enough to make a quick determination, and these are HR people, so they're trained to do this, as to how to direct this particular resume. To one extreme, it could be that, listen, this resume, you have to do more training. You don't qualify for this position you're seeking, or maybe look at another area. Or, to the other extreme, this is a very attractive resume, and therefore it is going to be directed to the person, the institution, the region that has the gap in this area. And then a follow-up takes place where a better conversation is had with the individual. So, you know, it is an important start of the process. And the people who are so trained to do, there's a form that everybody fills out to clarify some of the critical things with the resume, and then we take it from there.
And finally, Dr. Tufton, these 600 positions are, I know you're trying to fill them, but are these positions that will in any way impact the public wage bill or these already gazetted positions that are already taken into consideration when we calculate that number?
Right. So as I said earlier, the compensation review also resulted in posts being created, over 2,000 posts across the system for nursing and medicine. There are some other posts that may have been occupied through contract labor, which in the interest of retention, and we offer security of tenure by creating permanent posts in those at different levels. So the odds around the 600 are posts that exist, that are on the establishment, and therefore if we engage these people, and clearly the Ministry of Finance, as the case may be, would have to budget for ensuring that these people are compensated. So it's not a wish list by a region or a hospital. It's an established position that is not filled, that they would certainly want to fill to improve their output in the system.
Understood.
And are there plans, Dr. Tufton, to make this Career Expo an annual or an ongoing initiative?
Well, clearly we'll assess after the fact. This is a first for us. I think it was necessary, and so far so good. There's a budget clearly attached to this, and but I think we have to then assess in the context of whether it's worth it. Over time, it may lead to a level of awareness where we may not need to do it, but I do think that there needs to be a sensitization to the population periodically. It could be every year, it could be every 2 years or otherwise, where we expose all these various positions and try to generate interest for a career in health. And I think it's necessary, particularly in the areas that are often underrepresented, either because of a lack of knowledge or training or because the market dictates significant competition that works against us.
We have to leave it there. Thank you as always, Dr. Christopher Tufton.
All the best.
All the best. Dr. Christopher Tufton is the country's Health and Wellness Minister.